It depends on the relationship you have with your manager, but if you have a good relationship and trust them, you could meet them one-to-one to discuss what's going on. Be honest. Being as truthful as you can be about a problem is essential, as it will help your employer understand what you need. It's best to be concise about your feelings. You might want to consider having Mind's resource information for employers to hand, as it provides trusted information on conditions and ways to provide support. It might also be helpful to have a note from your doctor to explain what the problem is, how it may affect you, and what adjustments might help you manage your work. It is more and more common to find workplaces where people feel able to talk about the well-being and mental health, Marmo says. As attitudes begin to change, more companies and organizations are asking the right questions and taking the right steps to start the conversation with their employees. Make reasonable suggestions. Ultimately, it is up to your employer to decide the best way to provide support, but you can suggest reasonable changes, including changes to your working area, changes to your working hours, and occasionally working from home. Earlier this year, a web developer in the US sparked a global conversation about workplace attitudes to mental illness after asking her boss for 2 days off. In an email titled "Where's Madeline?", she told colleagues, "I'm taking today and tomorrow to focus on my mental health. Hopefully I'll be back next week refreshed and back to 100%. Related article: At a weekend in the mountains, did 4-Hour Health CEO Ben Congleton replied to the message, saying, "I can't believe this is not standard practice at all organizations," adding, "You are an example to us all, and help cut through the stigma so we can all bring our whole selves to work." Getty Morse Images. In the UK, there's no legal difference between taking a mental health sick day and a day off for a physical injury. According to data from the Office for National Statistics Labour Force Survey, 15.8 million days off work last year were for a stated mental health condition, including depression and anxiety. If you need to have someone from HR there, or having someone from HR present will make the meeting more formal, and normally wouldn't be necessarily in the first instance, Marmo says. But if you didn't get anywhere with the first meeting, then it might be a sensible next step. If you don't get anywhere with your managers and HR, don't give up. If you are being treated differently or your job is affected because you disclosed a mental health problem, you can seek advice from Mind's legal line 0300 466 6463 or ACAS. Remember your rights. If you have a mental health problem and you want the protection of the Equality Act, you have to tell your employer about it, Marmo says. Under the Equality Act 2010, employers have a legal duty to provide reasonable adjustments for an employee who has a disability, which can include a mental health problem if it has a substantial, adverse, and long-term effect on normal day-to-day activities, she explains. Typically, when it comes to mental health problems, these are small, inexpensive changes, such as more regular catch-ups with managers, change of workspace, working hours, or breaks. But we know that too often, people stay quiet, fearing being deemed incapable, unable to cope, or weak. It shouldn't be that way. Being open benefits your employer too. Mental ill health is the leading cause of sickness absence in the UK, costing an average of £1,035 per employee per year. In total, mental health problems cost British employers around £30 billion a year through lost production, recruitment and absence. So in short, it is in an employer's interests to ensure workers are healthy and happy.